Hello, so this is my Transforming Healthcare reflection video, and I'm not sure if it's, I guess, a remarkable moment, but it's definitely an aha moment. Um, just watching the video and hearing, the various cases and just really understanding how the trans community is really being treated and how it's kind of leading them kind of a like a ripple effect, um, leading them down a path that exposes them to HIV and therefore inflating the cases of HIV in the trans community. One specific um, instance or um, that happens within the trans community is of course discrimination. That is definitely obvious and unfortunate, but the discrimination that leads to lack of employment, which pushes these individuals to sex work. And it's one thing that I hadn't even really thought of, which was kind of a sad moment, really realizing that this discrimination is kind of leading all these individuals to something like that, increasing their risk of HIV. Another kind of shocking thing that I heard on the video was the injectables. How, these patients, of course, are wanting to transition, and a lot of insurance, of course, doesn't cover that because it's optional. um, and that kind of leads them, and they're low income already, so it kind of leads them to do these injectables, which are originally silicone, but of course they can't afford it, so they're doing it with, or injecting themselves with, antifreeze and motor oil. I was completely shocked to hear that. And of course, this is all happening in a non sterile environment. Needles are being shared. And of course, that's your exposure to HIV there. And it just kind of goes to show that if healthcare was a little bit more, not advanced, but more open to treating the transgender, I guess, prior to these exposures, like if insurance was able to offer um, more assistance in terms of their transition so that they can do it in a safe place, rather than, in a low income facility that's not sterile, could be in anyone's garage. It can definitely reduce the cases of HIV for these patients. So it's not, I don't necessarily believe that it should be treating patients with HIV. It should also be about preventing these patients and lowering their risk of getting HIV. Thank you.